Good afternoon, ladies and gentlemen. It is now 1:05, and I'm going to call this open meeting or special called workshop meeting of the Commissioners Court. Today is Wednesday, June 16th, 2021. It's 1 p.m. and we're in the Emergency Operations Center here at 401 Deputy Miller Drive in Granbury. And today we're here to discuss the logistics and feasibility of creating a health clinic in Hood County through the American Rescue Finances Plan. No action will be taken at this workshop, as it will be an informational workshop only. And we are very pleased today to have with us Dr. Blocker, and also the highest, am I right on that?
Second highest.
The second highest. Please stand up and introduce yourself, please.
Sure, I'm Dr. Becky Early Royer, a PhD doctor, not MD doctor. And I'm the Deputy Regional Director for Department of State Health Services here in Region 2-3. We're headquartered in Arlington, but we serve 49 counties here in North Texas. So thank you for having me today.
Very great. She was helped a lot. So, everybody here knows, glad to have you here, Dr. Quinn. So, Jay Webster, you want to kick this thing off?
I sure will, Judge. Judge, I want to thank you and the commissioners for allowing me to have the workshop to discuss this. I'm going to kind of be brief, and then I'm going to turn it over to the experts to talk about everything, so I'll just kick it off. So what we're here to do today is talk about asking Hood County commissioners and the judge to look at the possible creation of a Hood County health clinic going forward. Like you said, with the utilization of the American Recovery Rescue Funds that we have received from the Treasury Department, and we will receive again next year. To kind of talk about it from a very high level real quick, is to kind of let everybody know what we're looking at, is we want to create a health clinic that will promote and protect the health of those in the community by making preventive health services available to all the citizens that need them. We want to bridge a gap that we recognized during the last 4.5 months in this community that exists. And what I mean by that is by me and Ricky Reeves, our EMS director, having to step up for the county and be the vaccination hub, we realized that there's a big gap from the services that our partners with DSHS can do on a daily basis and what our other entities that we do have in the county do. And so kind of what I want to generalize real quick is when I talk about a health clinic is we want to learn how to walk before we take off running with the health department. And so this means we're looking at doing your general health screenings, your immunizations, your seasonal flu vaccines, any tuberculosis testing or treatment that we can do, rabies information or treatment, health education and events. That's kind of going to be the heavy side of that, is doing our health education events, doing our HIV, STD screenings and tests, along with our public health preparedness, which is what I had to learn on the fly the last 18 months on the public health side of emergency preparedness, of learning how to deal with, in case COVID round 2 comes along, lately having Doc Becky, Doc Blocker, and Dr. Massey available at my fingertips to guide me and educate me real quick on an MD, PhD on the fly. And so having that ability to have that person be able to plug immediately in on a full-time basis, keeping our plans up to date on how to deal with those things when they come about in the future. And then the last thing I'll touch on is our Women's, Infants, Children's program, which would be a WIC nutrition program, supporting the healthy eating of that, health screening and education towards those, and breastfeeding and support services. And so with that, I'm going to turn it over to Doc Blocker and let him take off running with it and go from there.
Okay. All right, I appreciate that, Jay. Thank you. And as many of you know, when I left the Air Force, well, let me give you the disclaimer. So I am a doctor who's done public health for over 20 years. In my experience, that was all in the military, from the military standpoint, where we have a specific military infrastructure and language that we spoke, and we interfaced with local health departments, county, and regional services in the states where we happen to be around the U.S., around the globe. So I have a lot of experience doing public health as a physician and as a physician leader. However, when it comes to standing up a health department de novo from essentially no existing infrastructure, which is really the challenge or an opportunity we have before us today. That's something that happens rarely. You know, again, we've done this a lot as far as you show up with your trained staff and resources in the Middle East or somewhere out, you know, in a rural area, and you work with what you brought. In our case, we have limited existing infrastructure that actually works or belongs to the county or the city of Granbury, and then we have a well-established network of volunteer organizations, charitable organizations, churches, Bruce Place Clinic, a lot of different things, the Lake Granbury Medical Center and others that have filled those roles as best they can here in the community through the years. Again, through, you know, you've got excellence over here, you've got excellence programs through the school district and the like. And then the rest of it all then relies heavily upon either the state, which again, Dr. Early Royer represents here today, the state, public health services, so that every Texan has at least a connection to appropriate public health services, or surrounding counties such as Tarrant County, who have a health department in place with literally hundreds of people. So, that was clearly highlighted when we hit this COVID pandemic, not only from the standpoint of we worked with what we had, right? And then we had to build it up and do what we could with the resources and volunteers we had. And then now we're in that recovery phase of this last phase of the pandemic. But one thing we learned from a standpoint of public health is, first of all, public health incorporates day-to-day life, folks' ability to live and work and go to school and successfully accomplish their, personal, family, and life goals. It's not just about seeing a doctor or a nurse in a clinic. However, those health issues affect every aspect of life, and so the goal with public health is to ensure that everyone at least has access to a minimum level of services, and that's why Jay brought up things like our Women and Infant Children program. That's why things like indigent health or immunizations for every child or things like that become so important. That's why things like the school lunch programs and things become so important, because we recognize every time we put a meal in the child, in the hands or the mouth of a child who is part of the public school system, well, we're actually helping to support that entire family, right? Sometimes multi-generational. So at least somebody in the family's got a good meal and is helping them have a healthy lifestyle. So public health globally overall kind of incorporates all these concepts. But here in the state of Texas, we have a couple of challenges in front of us here. When we talk about the size of the county, our county is somewhere between 60 and 80,000 people, depending on whether you're looking at census numbers, you're looking at folks who have secondary homes and things like that, who live and work and come and go from the county. And because of that, that goes back to taxes and funding and the size of our county functions and things like that. As of right now, the infrastructure here in Hood County, outside of emergency management, which again has dealt with the COVID emergency and has some infrastructure there. We also have environmental health as infrastructure, which do handle our food and water sanitation. As far as traditional public health programs that belong to the county, that's it. Emergency management, environmental health. When you incorporate the city of Granbury on that, then we also have some code enforcement folks and things who help with food inspections and things like that for the restaurants around the city of Granbury specifically, who again, that's a traditional public health function, right? And then we have of course we have like the animal control services, part of the sheriff's department, again dealing with animal control here in the community. And so once you get beyond that, again, everything is either done by private organizations, done by another county, or it waits on what available resources are there for the state. As far as the state goes, the state has one nurse and one person to help, answer the phones and coordinate on things that is based out of Hood County, but they actually support 5 counties out here: Erath, Somerville, Comanche, some of the others out in this direction. So when you talk about what has the state of Texas when it comes to day-to-day people who are physically in Hood County doing public health functions, it's one nurse and, like I said, one assistant. And they do help right now with some of the programs with immunizations and things like that. But again, they're spread thin over 5 counties. Tuberculosis control programs, sexually transmitted disease, programs that are formally managed by the state and then coordinated back up to one doctor who works with Dr. Early Royer, who is then responsible for, again, you know, what, 37 counties in this area that do not have a formal health department. So, so as far as my role goes, again, I'm a doctor with a lot of experience in public health. I've done this for over 20 years from a military standpoint. As your local health authority, I am appointed to, in essence, represent public health to this body and the community, whether it's the school district, whether it's our Chamber of Commerce, whether it's our other you know, healthcare organizations, the hospital, the clinics, and like, and so you know, again, without a budget, without a staff, without an office, without an infrastructure, without a supply of immunizations or even a place to put them. I mean, you know, what we have currently resourced is, you know, you have a very highly trained and educated individual with no resource in place to really support that county. So really, the bulk of my function and my support has been to ensure that we had appropriate information, timely information to our county, city leadership, other decision makers around the community, and really tied back with what resources were there. Whether it was medical resources, clinical resources, laboratory resources, resources coming from the state. But the last piece of that is when it comes to an emergency or a crisis, everything begins and ends locally. So at the end of the day, you know, we started with what we had, which was Jay and a couple other folks at the county, myself to advise and touch back to the state. And then as things ramped up, when it came to things that were very visible to our community, such as a COVID vaccination program. First it was testing, and what do we do about it, and what should we do as far as isolation procedures and things like that. And then it was, okay, now vaccination is available, but how do we get it? And when the answer was, well, Tarrant County has hundreds of people that work in the health department, and you can go to Tarrant County and get one, for a lot of our residents and our Congress members and things like that who were calling us, that wasn't a good enough answer. We had to figure it out here. Again, but we still had no infrastructure in place. So what I'd like to say, you know, at the end of the day, for that particular issue, what we had 40 to 50 people a day for over 3 months who came from around the community and surrounding counties. We had folks here every day that actually lived in Somervell County or Erath County or Tarrant County that were coming here to help us get vaccinations out to you know, primarily Hood County residents. But the way that worked was, hey, if you could show up and you met the criteria, you got a vaccination, right? That was the case whether it was given in Tarrant County or given here or whatever. So we had folks every day coming from surrounding counties to help represent and help get vaccinations to Hood County residents. And we ended up giving over 15,000 by the time it was said and done.
Right at 30,000.
15,000 individuals with 30,000 vaccinations.
20 something, he left on me, so it's 20 something individuals, 30 total.
Amazing. So when you look at that, and when you look at, like I said before, our county population is around 61,000 by the latest published census data. We don't have the 2020 information back yet. But you look at the fact that we were able to successfully immunize upwards of 20,000 people in our community just here. You know, that's really what allowed me as your health authority to be able to say, we've reached a point where we know, and we have the data to support it, that we have more than 2/3 of our at-risk individuals vaccinated in our community, which is 65 and older, which is folks who are in various, you know, nursing homes and institutions, things maybe they can't easily go get a vaccine, but we took it to them, things like that, as well as about you know, 30%, about a third of the overall adult population of Hood County. So when it came to how do we step back from this public health crisis, the measurable pieces such as, hey, how many immunizations we had, how can we document and prove that folks have had immunizations, how can we reopen businesses, how can we reopen county functions, that ability was priceless to us in our day-to-day life. Now, none of us has seen a crisis like this in our lifetime. We know we're going to have to deal probably with some booster shots for various strains of COVID. That's all, you know. But the fact is, for this particular crisis, we're kind of past, I think, the initial key point. But now that we've been there, now that we've pulled the community together, now we've got some goodwill from all over the community. How do we leverage that into success down the road? You know, hey, fool me once, shame on you. Fool me twice, shame on me, right? What do we do to take available funding that's being offered to us, grant money and the like from the state? How do we match that with the commitment at the county level? And how do we build a framework for future success and growth down the road, if that makes sense to us? So the state health code, and again, I'm very, very thankful that Dr. Early Royer is here with me, because she can come back and say, well, Dr. Black, that's a great idea, but this is really what we can do. The state health code allows for public health infrastructure and health clinics, basically to whatever scope that we feel that we can support, fund, man, etc. Everything from a health unit, which is a handful of folks that starts to do some of those essential programs that Jay outlined, but still relies heavily on the state level support for functions and programs. So to me, that's kind of the best starting point mindset, because you have something on the books that says this is a health clinic, this is a health unit, but it doesn't automatically say, well, now we've got everything and we don't need you anymore, state, we'll figure it out. Obviously, you know, I think we need to have that scalable resource to where we have a few folks who are doing this on a day-to-day basis. We can prove how they're gainfully employed with helping to do immunizations and health services and all important education to the community. And I can talk about that a little bit more when it comes to community needs assessment and what we have from again, some of our volunteer organizations, Cook Children's, United Way, Mission Granbury, and others that have come together and said, when we go out and we talk to folks who are getting the reduced lunch programs, when we talk to the folks, the 10% of the county that meet the federal criteria for you know, low income and poverty level, 10% of our county, over 6,000 folks in Hood County. You know, these are the things that we saw, you know, access to health care, transportation, you know, housing, education, and not just for children, but for adults too. And so those are all things that we've got ongoing programs with, you know, for a training center and Mission Granbury and United Way and all these things around. But I'll tell you, we as a county can get credit for a lot of that because that's all public health. And if we have a county ownership and a tie-in, we don't have to do all the work. But again, we can successfully say, hey, our county is participating in these public health goals that are outlined by the state as key and essential public health functions. And again, we don't have to do it all. County employees, you know, 3 or 4 people that are working those clinics and unit don't have to do it all, but we just have to be able to show how we're tying and partnering to get that done. And again, a lot of it's already there, guys. We're just not giving ourselves credit for it because we don't have a county function. So we can do a county health unit, or we can, no kidding, stand up a county health department, which has a larger cost in time in terms of manpower and resources and personnel and cost and what we owe back to the state. And then, so I don't recommend that today, but that is something that could be down the road potentially, or even more importantly to me, is what's considered to be a health district. So kind of like our emergency services agreements that we have with the surrounding counties like Somerville and ERAF and the like, we can use our initial county health, you know, footprint to build towards agreements with the surrounding counties and again leverage resources. So again, you don't necessarily need 3 nurses, but you might need 1 or 2 good ones to help support those surrounding areas. I told you right now, the state's got 1 nurse that supports 5 counties. So anything we do will be better than that. So anyway, the idea of down the road, not today, no, you know, but just to let you know that in the state health code, it allows for scaling and growth over time as the community continues to grow. You know, as our county continues to grow, as we're building infrastructure with roads and water supplies and airport and industry and everything else, it only makes sense to have a county health footprint that incorporates the emergency piece, but it also incorporates starting to tie in with all the other essential health functions. I can go down the list and share those with you as far as those emergency health functions, but what Jay's already shared, kind of like those are some of the key things, right? Immunizations, childhood immunizations, education, women, infant, and children programs, and things like that that already have analogs through Health and Human Services and you know, kind of a footprint and an opportunity. We basically can tie into that and show how we're helping with those health education and those programs and things like that here in the county with very, you know, relatively minimal upfront cost. So that being said, I think that kind of covered the main big picture points I have. What Jay and as he mentioned, Ricky Reeves, and y'all know Ricky as our Texas EMS director and here at the table for a lot of things. Y'all also saw him and his staff largely represented. They were the core of the team that led the medical response for our vaccination efforts, right? And that was all, you know, all volunteer time, all out of pocket for them as our local emergency services. As most of you probably know, but in case you don't, and I don't know, I think you probably do too. Ricky also is one of those folks that he lives out here in our community, and he's the director for Texas EMS, but he is also the director for the North Texas Regional Trauma Advisory Council, right? Which basically is a coalition or function that incorporates, across most of the Metroplex all the way out to here. How do we leverage resources together when it comes to emergency services, ambulance responses, mass disaster responses? So Ricky has a lot of great experience in what that looks like in the state of Texas, which again is really important to me and to Jay, because again, mine's military stuff and his is from the DPS and emergency standpoint. So working with Ricky Reeves, we were able to get a workable footprint and demonstrate great success with those vaccination efforts. But he's also been able to sit and kind of talk through what does it look like, what does an initial county footprint potentially look like in comparison with some of the other small counties. The other thing that we've done, and again with help from Dr. Early Royer and Dr. Massey, who is the physician that's at the region, is we talked to some of the other smaller surrounding counties in Texas, again around 75,000 people or less like us that have health departments. When I asked them what did their footprint look like, how many people do they have to do the job, and how long have they been there, every one of them said, well, they've been in place since the 40s or the 50s. No one stood up a health department in Texas since the 1940s. So kind of like none of us has ever faced COVID or an influenza pandemic like this before. None of us has stood up a health department either in our relative lifetimes. And so what we have is we have kind of this I won't say antiquated, but we have the state health code that was set up years ago as guiding documents. We actually talked to, hey, who's done this lately? So far, the answer around the state of Texas is nobody has stood up a health department in a county the size of ours in decades. So Dr. Early, like we talked about earlier, I told you I wasn't going to intentionally put you on the spot. At the same token, I think you have some great insights to provide as far as what do we have to do if we say we're going to open up a health unit versus, what does that look like for us, and what is our bill we owe to the state right away? You cut all ties and we're on our own. What does that look like?
We never cut ties.
I know that, but I want the crowd to know.
So, Dr. Blacker's correct. So the formation of whether it's a local health department, a unit, entity, we have tried as deputy regional directors to get clarification on all those little terms as well, and it's very a mixed jumble of definitions. So really it comes up to the county as far as where you would want to start. And when you become either a unit, an entity, or a health department, it's recognized by the state. And at that point, there continues to be this collaboration. So if you would happen to do a clinic, like you were talking about for immunizations, that clinic could become a Texas Vaccine for Children provider, in which we provide the vaccine for free, and then you could charge an administration fee. So I have a background in being a health commissioner for a small 30,000 county back in Ohio, so we work very diligently on coming up with the funding structure to have a sustainable health department. And so in Texas, while DSHS, we don't charge outright for an administration fee, we do take donations for an administration fee, but the actual vaccine would not cost your clinic at all, because it all comes from the state pharmacy. And so you as a county can develop a fee structure. Usually it's like $8 for the administration fee, but that goes to help cover the ancillary supplies and the staffing. Along with that, we have the Adult Safety Net vaccine program, similar to the Texas Vaccine for Children. And so that vaccine can be provided to you. With the adult, there are some restrictions on who can receive those vaccines because they are free. They have to be uninsured, meet eligibility guidelines, they have to sign a piece of paper. So for the clinic you're talking about, those are options for that. I have seen in my short time with the region is we have a couple health departments that are kind of large, like Hunt County, for example, and they really do vaccines and epidemiology work and preparedness. And that's kind of where their happy point is. We still assist in all the TB, HIV, and STD. So it's kind of a mix. So as you're working through this, and you wanna kind of pilot what it would look like, you know, we're here to help support you and, you know, talk to you about what are the resources that when you become an entity, a unit, or a health department, the resources that open up from the Department of State Health Services. If you decide to do HIV, STD, or even TB, we have the TCID, the Texas Communicable Infectious Disease Hospital down in San Antonio. You know, we send patients there when their TB is at a level that we can't treat locally or they don't have the resources to treat locally. So that's an option. We also have a DSHS pharmacy. That pharmacy provides the vaccines, but we also provide all the treatment for HIV, STD if you have somebody that's seeing them. We provide the medications to treat TB. So that's another cost savings as a identified unit, entity, or health department. So there are these cost saving measures to the county when this occurs, because those are the resources we have available to us to provide services, and that transfers over to you if you decide to be a recognized unit or entity or health department.
Well, I appreciate that, and so on one side there's a staffing and a manning cost as far as clinical personnel and a place to run these clinics and do all that kind of stuff. What can you give us a thumbnail sketch of what the administrative cost is to us? Because again, it's not just enough. I can be in clinic all day seeing patients, but at some point paperwork's got to be done. We got to report what we did with those. What does that look like?
That'll vary depending on what services you're doing. So from a regional standpoint, a lot of we don't do billing. As a state, we don't bill for health services except for the TCID hospital. And so the billing part, I can speak from when I was a health commissioner of a county. We had one individual that billed for our dental services because we ran a dental clinic, a full-scale dental clinic. And then we had 3 other administrative staff that would bill for family planning, they would bill for immunizations, and they would bill for well child clinics. So there is that billing component. At that point, we weren't set up with electronic health records, so if you invest in that type of structure up front, it does make your billing and your administrative costs significantly less, and you need less people to be able to do the billing and bring that in. And then, depending on the number of people, there's an HR side of it. You know, as a region, to cover what we have, we only allocated 125 employees to cover all of our regions. And we don't have an HR individual, and so you got that aspect as far as administration. But if it's under the county, maybe you already have HR that could supplement that role. And really, you need people to provide the services, and whether that's one nurse and one admin to go out to do the clinics, it just really depends on the structure.
Thanks for that.
And, oh, real quick,
Yes.
and then if you want to look at like what salaries there are on the State Auditor of Texas website, they have classification scales and job descriptions. Our nurses in the field offices are called Public Health Nurse 1s, and then that will give you what classification scale, and we try to start out our staff at the mid-range. So if you want to kind of do some salary forecasting and what that would look like, those rates on the website would be comparable to what we pay in our clinics and in our staff. It's always hard to know how to be competitive, but that's how we set that up, if that would be of any help for you.
Great. Two more kind of areas that I've seen and I've heard that I want to at least put out there. And again, whether or not you've got specific insight on that, or at least we can identify these things. One of those is grant money. Obviously, one of the main things one of the main reasons we're here at the table today is the special grant related to the COVID pandemic and recovery for across the state and across the counties. That's provided some funds that we could say, hey, this is related to public health infrastructure recovery, and this is, a sizable amount of money that's available to us as kind of seed money here. But what I want to make clear is that there are always grants for these different programs that are administered. And when I talked again to Brown County, when I talked to the folks in Milam County, they're talking about how they always have grants and funding that are coming to pay the expenses of their staff, their support, their resources needed to maintain and run these clinics, because there's grants really deal. But it's kind of like a chicken and egg deal. You got to have somebody to be in the seat and have a program to access the grants before you get the grants.
So many of our staff are grant funded. So our TB program is from a grant from the CDC. That would also go for local health entities and health departments if they're running a TB program. Our HIV STD staff are all grant funded from the CDC, which comes through the state. And our local health departments also get that funding. Preparedness, there's a cooperative agreement grant. Unfortunately, right now, that money is not available unless you were one of the 45 local health departments that signed on when it came out. But those always come up for renewal, so if you're already a recognized health entity or unit, you would be eligible for that. Our nurses are paid from our community health improvement grant, and so that's maternal and child health. That's also tobacco prevention. A lot of the activities we do is within that maternal and child health. So when it comes to funding, all the staff, not all, most of our staff are grant funded from the state, and as a local health entity, you would have those direct connections with the state programs to discuss that grant funding and how you would be eligible for that. We don't decide here in the region who gets funding, who doesn't. That happens down at central office in Austin. But you would have that direct connection to have those conversations with those individuals so that you would be eligible. But the key part is at least getting to the point you're recognized as a health entity. Because unless you're recognized as a health entity by the state, then you're not eligible for those grant funds that come out. I can give two recent examples that we're working on right now as a state. The CDC has the Public Health Workforce Development Grant that is out. 71 million is coming to DSHS. It was 43 million going to local health departments and entities. And then there's so many million for school nurses, I think 38 million for school nursing. But to be eligible to apply for that money, you have to be recognized as a local health entity or a department. We also have a fairly large health equity grant that is available to local health departments at the time now. And it's competitive, but it's not like you're writing a full-scale grant application because the state does that. It's really putting what your concepts are into a SurveyMonkey survey, and the state works with you and does it all. So sometimes grants can be overwhelming, but the state really assists in ensuring that it's not overwhelming for you, because our goal is to get the money into the local communities. So those are two recent examples that local health entities are eligible to apply for that funding. So that, I think it goes back to the importance of getting, whether it's an entity or a unit to start with, up and going, so that you do have that ongoing opportunity for future grant funding through the state. Does that help? Any
Sure does.
questions?
Being a health clinic, would that be the same qualifications as being a true health department?
It's all about the naming. So if you want to have, you can even call it like a local health unit, entity. You can call it a department if you want to. You get to decide what the services are that you're going to provide. And it's really about the naming and getting that recognition from the Department of State Health Services. City of Garland, for example, they are considered a health entity, and they do epidemiology and what else? Inspections. So they're not a full health department, they're more of the entity unit, but they're still eligible for this funding when it comes out. So it's really based on what you see as your beginning footprint to start a good foundation, because once you start a good foundation, you show success, as you know, that leads to more grant funding, because they see that you're able to progress forward.
We just picked a clinic or unit or whatever to try to stay away from, we're trying to play with the big boys. We're trying to stay down here to learn how to walk and figure what it is we can do to the community, or what we want to do for the community before we use that department.
Yeah, there appears to be a distinction, again, in the rules and regulations as far as once you say you are a health department, it's implied or assumed that you're gonna provide all of the essential public health functions, with less support from the state as compared to what she was saying. You're just doing immunizations, you're just doing epidemiology, you're just doing vaccination clinics, you know, and so anything within that scope of public health still counts as you're doing public health, but it doesn't obligate you to have to suddenly figure out how to do all of it. At least that's my impression, and that's, you know, you're saying you'll work with us to do whatever, but that name does matter, I think.
It does, and like I said, we've asked several times the central office in Austin about the differences in the names, and it's very convoluted, and there's not really a good response that we get back. So I think if you develop what it is you want to start with, then it's probably best to say, okay, this is what they're gonna do. What would you classify them as? Would probably be the best way to figure out which of those categories you're gonna fall into, knowing that you're not stuck in that category if you expand.
Well, and part of that, I think, too, is the historical pairing and tailoring over the decades, right? Somebody started off, again, they had a military base and they had the full health department because they were working, you know, it's in my experience, right, where they had certain functions that they kind of had to do to qualify for that military base support. The military base went away, you know, Groundwood, you know, decades ago, and then they kind of paired and tailored over the years as far as what they still were going to continue to do versus relying on the state or other regional agencies. And so I think that's part of it too. Kind of what were you called decades ago, and they got to kind of keep that name. The last thing I want to make sure is out there before we just kind of open for more general discussion. And again, it's going to be as long or short as I told you up front. I'm not the expert on this, you know, but we know some folks who are, right? And we can work through this out and bring questions back and work over time to put the framework. But the other piece was volunteer support. One huge thing, again, as we've already talked about, the recent successes we experienced by bringing all the volunteers around the community. I mean, when it's all said and done, it was 40, 50 people a day, but we had, you know, well over 100 folks who were regularly supporting when they could, you know, our local efforts to vaccinate folks for COVID-19. There are some frameworks that exist out there, and again, that are used very successfully by some of our other surrounding small counties, like Brown County, Milam County, others, where they keep a repository of those folks. They say, hey, this person's a doctor, this person's a nurse, this person's EMS, this person's a community volunteer, and they have a formal system to kind of categorize and vet that, so that when the next thing happens, when the next crisis occurs, when they need to work with the community, open shelters or whatever they need to do, or do a you know, vaccination effort for flu or whatever, they already know who showed up before, they already know what their credentials are, they already know that they're willing to volunteer and help their neighbors. And so if we do nothing else, leaders, I recommend that we make sure that we incorporate that before we get too far away from this effort, where we not only, you know, hey, give everybody a pat on the back and hey, look what we did, great job, but hey, let's keep your number in the Rolodex for next time, right? Because there will be something, it may not be the scope of what we've had to do, but there will be something that we'll need to do again. And so I think that's really important that we do that.
So let me touch on that real quick while he's talking about that. We had over 300 people on our list that for the last, and I'm going to go back it up a little further, the last 5 months, that has come through this building in some form or fashion to help me, help him, help Margaret, help something that we were doing that was for the community, for the county, primarily for the response of COVID and anything that was touching COVID. We've already done that. We kept that list, especially after we ran the vaccination hub. We've kept that list, so we have we know who our nurses are. We know who our retired doctors are, and we've already let them know. And it's amazing to me that we worked them 4 straight months.
Yes.
Hard. We did 42 days total of the hub when you spread it out over the months. Anywhere from 8 hours a day to some days were 15 hours a day. and they kept begging to come back for more, and they were even sad when they went sent home, wanting to know when can we come back to work. So what he's talking about there, we've already done. We have that list. Anytime we need it, no matter what we need it for, I can already tag into that list, and it's there, along with some other people that have resources. And so we've already built all of that establishment. A couple of things I want to touch on, and he was talking about earlier. Coming out of the vaccine, when we finished up, some of y'all know this, out of the 47 hubs that were operated under TDM out of Region 1, we were number 5 out of the most done of the A and B categories. And so it's per capita, but when you look at that, when we're competing against TMS, who's doing 10,000 a day, but yeah, we maintain number 5 status of doing the senior citizens and the other categories. That says a lot about what, I always jokingly say, a couple of rednecks and a bunch of volunteers and a couple of paid staff members did for this community. It took a lot of work working with DSHS and our other contacts and things that the judge did, things that the mayor did behind the scenes. To kind of roll into some more conversation it's what I'm asking the Commissioners Court to do and the county to do is look at the opportunity we have, take the funding to help me get the big train moving, and then start tagging in as we go forward into these grants that are available to help us in the future to continue to fund something that we can get going now and let it continue to go down the track with everything else as the county can support it, or the other grants that we can start tagging into can continue to support this 5 and 10 years on down the road.
So Jay, we talked about kind of a recommended minimum footprint. And we haven't talked about that yet today, but I know that that's going to be really important because again, you talk about, hey, staffing, size, what can reasonably be expected for folks to do.
So yesterday, just for clarification, with making sure I had my notes right with Dr. Blocker and understanding titles and names, recommendation would be 1 nurse practitioner, 1 administrative nurse or nurse administrator, whichever that is, and 1 LVN. The nurse administrator is kind of like your boss. She makes everything happen. She makes sure the paperwork's turned in. She makes sure that this happens or that happens, that the PA that can do clinical type stuff can do their job. And then if she's gone, she can still step in and do that job and help the LVN, or the LVN can help as well. That's the bare minimum that we talked about. That way, like I said, if one's on vacation, you still have the availability with having that other nurse administrator to step in place of the PA. Building, had a conversation with Dr. Glenn. We thought we had some facilities with him. We're not sure. There's still conversations that I'm working in the background. Is there some available space? Not sure if the county has any available space because I don't have every building in this county memorized. If not, what does that look like that we have available to rent? The funding that we have available will cover any expenditures to start up the clinic, whether that includes remodeling or rent. So if we have our own building, but we need to remodel it to configure it the way we need it to be set up, that funding will pay for that. If it's renting a building and remodeling it, that will cover it as well. It's just how extravagant, do we want to go? And so I've set some aside.
Can we purchase building?
Can't purchase a building. That I've found, yes. I don't want to say a flat no, but I'm going to say right now, based on the minimal answers, is that buildings are not one of those things that they're looking for us to buy. The main goal of the funding that we're getting from the Treasury Department is to focus on public health, public safety, number 1, and then kind of start looking at other things down into the broadband, water, and sewer. We don't want to get into broadband business because we don't want to get there. Water and sewer infrastructure we don't have. So we're kind of focusing in on those main categories of how can we better provide services and functions with this funding for our community through the public safety and public health side.
And I think the other important thing, and again, I'm no expert on this. I'm doing my best to understand, what's in this kind of Texas code and how these things overlap. I know we do have a hospital district here that's already a county function. As I understand the code, and again, we've got experts we can tap back to to help us make sure we're doing the right thing and everything. This is complementary to that. It's not excluded by the hospital district, and it's not required to be a part of the hospital district. This is a complementary function that's a health clinic function or health unit function. Because again, the hospital district really focuses on hospitalizations and severe illness and bad outcomes. The public health function focuses on keeping people out of the hospital, keeping them well in the community to be able to go to school and work and be productive members. By the time they get to the hospital, you've already passed that point, right? So this is all about keeping people healthy with immunizations and education on health and nutrition and all those kinds of things. So those are complementary functions that are accounted for. And you know, like I said, it's not a competition thing. They support one another, and there's clear evidence of that.
I do want to touch on the fact that nobody wants to talk about this, but what we are reading in the background of what could possibly be coming through the next strands of COVID, if it does happen, I can tell you that the almost 25,000 that we vaccinated, nearly every one of them, as they're walking out the door, are you going to be the one to give me my booster if I have to have one?
And there will be.
And they're already, and so not only do they call me now because they lost their vaccination card, but now, you know, they call and going, hey, we're just checking who, so they're already preparing.
Right.
And so I'm telling you that because at some point, is it gonna be me and Ricky having to step back up and do what we just did? Or we can't lean on DSHS because I can tell you that Nurse Ginger Brown down the street called me on several occasions
Right.
to ask if the vaccination clinic could actually help her.
Right.
Because they were so overwhelmed, or there was special things that were going on with certain patients that she couldn't handle, that she knew we had the EMS staff on site, and so the roles had to be reversed. So she's reaching out to a volunteer vaccination hub to help them. And so I just want to give you that big picture of 41% of the community, at least the majority of that wants to know, what are we going to do going forward to help us? And that's 41% is your senior citizen group of retirees, that they're already asking those questions. And so I can tell you that 50 times a day of answering the phone pre-vaccination in January, of having to tell them I could not do anything because I wasn't a health department, we didn't have a health department, and I didn't have a medical license to get the
Nobody
vaccine.
likes that answer.
Yes.
Even when that is the answer, nobody likes that answer.
No offense to anybody in this room that's older than me, but some of those people can be pretty dang mean on the phone.
Yeah. Well,
I'm just saying.
And the other piece, Jay, is the fact that we do have, because we do have a sanitation function for the county.
Yes.
Jeannie Stacks,
Oh,
who's
yeah.
currently
They were
running
calling
that.
her, where do I get my shot?
She gets those calls constantly because again, when you go back to the state websites, because those are public health functions, when the state has to list who's the public health contact for Hood County, they get environmental health services. And so they fill those calls constantly. So this is also, so again, big picture, this is part of helping to clarify those lines of responsibilities, and it doesn't take anything away from Jeannie and her environmental health. It doesn't require a change in that function. However, it adds more infrastructure to match what's expected across the state.
So not asking for the Ferrari, we're just asking to take a serious look at, we have an opportunity, we all feel like, to do a really good thing and get something really good started, and then let somebody down the road after it's good and up and running and has a good foundation to take off and run with it.
How large of a building do you anticipate needing?
3 people, so two possible exam rooms and maybe I'm looking at both of y'all.
So he'd be ready, yes.
Can I tell you? Yeah, I can tell you the minimum footprint.
Yeah, if you got it, I'll be glad to have it. I'll let you
As
have
far,
it.
as far as space requirements go, obviously you've got a waiting area, you've got a check-in area, you have a records management and safety and security area, which has a very specific, kind of like the cybersecurity stuff. I mean, they got to be double locked, they got to be able to secure that room locked away from everything else. So, as far as any kind of patient records or documentation, electronic or hard copy. You've got staff area for folks to work the computers, and you have a minimum of 2 exam room spaces that are private and that meet the sanitation requirements of, hey, it's got a sink in the room, it's got a floor other than carpets, you can clean it up if anything spills away. So a minimum of 2 examination and treatment areas. Usually you've got 2 exam rooms and then a larger treatment area. So if something happens where someone's having some type of emergency, or you're doing doing any type of minimal, you know, procedure, or whatever, you got a little bit more room to work around, get a couple people in the room. So altogether, you know, I can't tell you how many square foot that is, but it's not a huge space, but there are some minimum, you know, health and safety requirements for clinical operations that would have to be met.
What's y'all's size of y'all building on
I was gonna say, can I add some more to that? Cause
Yep.
if you're gonna do vaccines, it is highly,
Cold storage,
you
yeah.
gotta have your own, like, pharmacy area where you put the refrigerators and the freezers, which require a little bit additional, air conditioning to keep it at the level that's needed.
Oh, it's very specific
It's very
requirements, because
specific.
or else you have to throw them all out, and you wasted those vaccines,
Yeah.
yeah.
So,
Cold chain storage.
so I would suggest a room for that, and if you're going to do TB, HIV, STD, you need to have a lab, preferably with a client bathroom with a pass-through window,
Right.
so they can, put their specimen in there and you can go around and do what you gotta do in the lab. So those would be two additional areas that
We've
I
got a
would
couple of them we
suggest.
can tour,
that we
see
add.
how they do it. We've got a couple of clinics,
Yes,
even
yes.
Pecan Plantation being a great example, how they do it out there.
Right. I usually see a lot of that co-located space, right, as far as here's your minimal footprint lab and cold storage and overall storage area, right? But you're right, those are absolutely perfect.
Small rooms where they take blood.
We have a, clinic down here by Granbury Police Office.
Yeah.
Is that where, I don't remember the road, I
Yeah, yeah.
apologize.
Yeah, it's down by the PD.
That's why I
But
think
that
those
would be
pictures
a
were
great
interesting.
opportunity if you wanna see what our clinic looks like in the space layout. We could easily arrange a time for individuals to come and take a look at that, and you'll see how our cold storage has, that unfortunately does not have a lab.
We'll be first.
So that is one deficiency of that building. But any new clinics that we've been renovating our offices, we put a lab in. It's been highly requested, that they're not using a public restroom and then carrying it through the lobby and the clinic,
Well,
so.
and when you say lab, I mean, that technology has changed so much too, as far as the automation and the machines. It's not your traditional where you got, racks and racks of blood spinning in tubes and all that kind of stuff. I mean, it's,
And some of we have our refrigerators on one side of the room, and then we have our centrifuge and our lab equipment on the other side with the sink. So it's not anything extravagant, really large, but it is nice to have those separated spaces.
If I was guessing, your space down there is probably 1,000 to 1,200 square feet. On
But
that
there's
half.
nothing, like, we don't have the whole building.
Right,
Okay.
no,
We don't even have
On
the
that
half
side, there might be 1,000 square feet.
Yeah.
just have the health and human services there as
Yes.
well.
Yeah, they have the back part of that on our side. We have, it's a
Right.
pretty small clinic, but.
Right.
Okay.
That's all I got.
I think it's needed, we have to go ahead and move forward with this. So I'm all for it, I think. We're just gonna have to decide what we're gonna do. I guess it's more the services that the county's gonna provide than what we're gonna call it. If you're gonna do just vaccinations and whatever, then the state is gonna go ahead and classify it as a unit or a clinic or a department or whatever, and then we get to participate in a grant, which brings up something else that we've talked about, is to hire somebody to write grants that can work in all departments countywide to help you out from the emergency management standpoint, to the health standpoint, to law enforcement, to everything else, to have somebody that's a real designated, trained, you shaking your head in agreement, aren't you, Dr. Rohr?
I used to do that, yes.
Yeah,
It's very beneficial to a county.
I mean, if they
To
got
have
one
one person.
grant and got the money in a year, it would definitely pay for each other, but hopefully they would get numerous grants and would lay the groundwork to do that, so.
And the benefit of having one individual across your county is they're able to make the connections in the grant among all of your agencies instead of being siloed, which is highly important in grant writing, is knowing what are all the resources and how they all play together to make your grant stronger, so.
Or hitting something and it doesn't qualify for this, but then you can see that it does qualify maybe for something else, and that we can do that, so. That would be very beneficial to doing that, and I know that, really, everybody did work together, I mean, extremely well, and with the volunteers that we had, I mean, I went through volunteer system myself, and everybody had such a positive attitude, and people with this pandemic, COVID, with such a division with people, but everybody had the best attitude up there at the school getting the shots. I mean, from the greeters to the exit people and everybody in between. I mean, it was just, it was an amazing sight. I was there, what was the guy that got the, what, 10,000th vaccination?
Bill
Is that-
Guerin.
Huh?
Bill Guerin.
Bill Guerin
We're
from.
not golfing, 90 years, 87 years.
87 years old.
90, isn't he?
Not, well, he's close to 90.
Yeah.
No, that's what he shoots on the golf
Oh.
course.
Almost your age then?
Yeah, close to my age.
I was 9,999. I think Jay Webster just changed it, saying I would be a good face with that discount, I would be, but, anyway, he was 10,000, but this guy was really amazing to do that, but everybody did, so we gotta work together to do this. I can't believe that there have been no new health clinics created since the 40s or 50s. But I guess it's had been a real need for this.
I mean, there have been in other regions, when I talk to my counterparts, individuals that are interested, and they have a meeting, they talk about it, but then there was never any forward motion, so.
No. I think we're just gonna move forward. I think we got somebody good. I see Margaret Campbell over there, she just can't wait to get involved in this.
You know, you gave us a lot of information. We'll just need from Jay, what's the first step the county needs to do to get off, what gets it started?
Yeah,
Talk to,
I was gonna say, I'm gonna have to ask that question.
You're
Becky,
raising your hand.
we need
Is it
money.
Is
You
it
have
money?
money, you have to accept it, and do a Dave's favorite word, unanticipated revenue budget amendment. I have it in place, I have the revenue part, I have the expense part, I do not have the expense part broken down yet. I'm going to work on that between now and court time, but I do have it in the form of special revenue. That's, government code says you need to do that. You didn't have it budgeted at the beginning of fiscal year 2021, you did not know they were gonna get it at all.
You're talking about the first payment from the American Rescue Plan.
Correct.
Just gotta keep it in a separate bucket.
We're gonna keep it in a separate fund, utilize it that way so that the reporting can be managed and transparent for whatever anybody wants to see.
I have to provide a report, I was telling Becky by July, end of July, 1st of August, on what it entails that we're looking at spending the money on. It's not locking us in, but I have to provide that report. And then what comes after that is cost reports that we have to turn in.
Well, what I wanted to ask is this, since we have some money, that we can do about, what was the amount of money that we need to get started to do this? That's the first thing that we would need, wouldn't we?
You would need to agree collectively,
Well,
sir.
I know that.
And that's
The
what I'm trying to get you a
Commissioners Court,
budget.
I'm asking the two experts here, what is the amount that would need to do the seed money, let's call it the seed money, to do the footprint, to get into the business? What is that amount of money?
It's
Really gonna be on what services you're gonna start with, if you need a building.
Well,
And how big of a building you're gonna need, I suppose.
Yeah,
And you can't buy a building, correct?
right.
You've
Not
got
that
to utilize
not
something
that
you
I have found yet. This is like some other things I'm working on. I've got half an answer, I don't want half an answer, I wanna be able to go 100%, so right now
That
the
makes
answer is
it
no.
hard for me to give you guys a budget.
Well, within your
But you
department
know where
right
you're
now,
gonna get the
which
budget from. You're gonna set up an account, so whenever the decision is made to spend the money, we know where it's gonna come from. It's gonna come out of this account.
I'm gonna give you a rough draft on where you can start it. You can always do budget line item transfers to get it proper as you move along. But before you can spend a dime of it, and it will pay for his and Margaret's salary, so I'm anxious to get this in place, so we can start utilizing money. So it will be a rough draft attached to the special budget amendment.
well, and I want to say this, is that I don't see Drew here, I guess he's working on the deal, but the internet has been down since early this morning throughout the whole county. So we're not cutting off the agenda items for next Tuesday at noon today. We're gonna keep that open, and I don't know when I'm gonna close it, because I don't know if anybody, if you were planning on getting something in this morning, You had 3 hours to do it before noon, there was no way that you could get it, so, and if it's still not on, we may have to extend it until, you know, maybe noon tomorrow, or even later than that, depending upon
You're not ready for this Tuesday, are you?
when the
To come to
internet
court?
comes back on.
So yes, she will be in court on Tuesday to ask y'all to accept the money so that it can be put where she needs it to be put. Once that is agreed upon, then
Hit the ground running.
we can hit the ground running with some other stuff, but.
Okay.
I've got a couple of questions. For one, how does this, is there a possible tie-in with an indigency clinic? Is this something that, you know, we've talked about that a little bit with is this something that
Yes.
can tie into that?
The
help
answer
fund
is,
that?
the answer is yes, and even in other small counties, obviously in larger locations, you know, again, Tarrant County, across the Metroplex, around Austin, et cetera, they have that as a existing part of some of the public health, clinics and units that are already out there. Again, it goes back to what is the flow, what's the workload, how many folks need to be seen a day, what's the budget for that, as another piece of overall, it falls under the umbrella and it can be done. There are other counties that have continued to keep those separate. The piece with the jail and the inmates under the sheriff's department, so usually those are kept as separate budget line items, including the health care provided and everything for the folks that are in the jail. But those are things that every county has to do, right? The indigent health care piece, there's a whole nother section of the code that's talking about indigent care and care for the folks that can't afford or don't have other health care, right? And so the county is responsible to provide that function, but whether or not it exists as a separate one like it does now out of necessity, or whether it's put under the larger umbrella of public health, that is allowed. It just goes back to where you want to draw those lines and how you want to budget it. I would recommend that until you have this established, you can look at that as a second tier option as a further plan. But if you already have an existing function, already have an existing requirement, I wouldn't recommend day one merging those together until you have a better idea about what we can do from a public health standpoint, and then work towards the next tier of merging those. But that's my perspective.
So, yeah, you know, I guess part of what I'm missing here is if none of these have been created in the last 70 years, why
Right.
is this a good idea?
There's gotta be a reason for it.
You know, yeah, I'm like this, there's something going on here that, you know, and I'm not trying to rain on the parade or anything, but I'm like, why, what benefit do we get? Man, you can go to Walmart and get about any vaccination for, you know, pretty darn cheap. It's, and they do a great job. Now, this is a very specific situation with the pandemic and the vaccine coming out in a very short period of time and giving a lot of them at once. But that's a very specific situation. That's probably not gonna happen again. You were talking about the booster shots.
Right.
You know.
So here's what I can say about that. And again, I'm not an expert in how it's always worked in Texas. Like I said, I come from the military standpoint as a doctor doing this where we had an infrastructure, right? We're going to a place where there was infrastructure. But what I do see is there's some very clear distinctions between counties that have, 20, 30,000, 20, 25,000 people. And then once you start hitting the 75,000 to 100,000 level as a county, Texas law starts to require other infrastructure requirements for public health and health and safety code, right? Things that the county is responsible to have a plan for, to take responsibility, or to partner with other counties to accomplish those things, such as in the areas of the Metroplex. So we're just close enough, we can see that going on. We've been able to leverage Tarrant County support, John Peter Smith Hospital support, a lot of those kinds of things, right? But as we continue to grow, if we don't have a plan, if we don't have a seat, again, as we're hitting that 75 and plus population, it's gonna catch up with us sooner or later.
Well, then that's an answer that probably makes more sense than anything that's been bouncing around in my head this whole time, is you're gonna reach some kind of requirements. Now, I know that, occasionally they'll have, and I don't know if this is exactly the same thing, but low-cost vaccinations on Tuesday in Palo Pinto County. Is this something that can be combined with other counties, worked in, you know, does this have to be all on Hood County, or can we work with other counties and share that, you know, cost or?
We absolutely can, and we should. I think this kind of goes back to some of what you were sharing before about in places within the Metroplex have already got that figured out. You know, Garland says, we're gonna do this, and the rest we're gonna rely on the state or rely on the next, you know, the next county or next function over. So that's already happened out of necessity. And as I mentioned earlier, even with this pandemic, we've leveraged resources specifically with Somerville and ERAP. On the medical director side, you know, the doc who is, again, his day job is he's working at the hospital at Glen Rose Medical Center. However, he's their county health authority. And so again, the virus didn't respect who lived where, whatever, you know, and folks at Pecan are getting care through Glen Rose and all. So we were talking every day as far as, hey, you know, here's the address of this person, but they're being seen in Glen Rose, they're being seen at the hospitals in Tarrant County or whatever, you know, whether it was deaths or severe cases or ICU cases. We were talking back and forth every day. So it's a very simple, you know, again, this was an informal communication out of necessity, but once you have a health function, a health unit, then you can formalize more of those agreements and share some of the funding costs and responsibilities for that as well. But again, that goes back to Somerville County's function like this and buying in if we choose to take the lead on it. Or here's the thing, and when I walked into this today, I had three major things. Well, one thing was just, hey, kind of awareness of where we are so far, what are some of the successes we've had. Since, you know, last time we were talking, it was emergency meetings about whether we're gonna open or close, or wear masks or not, or, limit functions or reopen functions, right? And then it was emergencies about how do we get vaccines here, and what do we look like when we don't have a footprint to start with, right? Didn't have a volunteer system to start with. So, but there were three main things from my perspective. Hey, do nothing. If we do absolutely nothing, we're still here. The next thing happens, the next time we need immunization or whatever, then you got Jay and one or two people that work with Jay. I'm volunteering to come over, Ricky Reeves is volunteering to come over, and we call everybody out to ask for some more goodwill from the community. But you gotta say, the natural question is, well, now you did that for me last time, why aren't you doing it for me again? And why doesn't everybody, you know, it goes from a one-time mass event, we all responded in emergency, to why did we not have a plan for the next one? Right, so I think there's some obligation to at least consider it and document what we did or didn't do, right?
What happened to us back in January, February, March of 20, we were getting the calls.
Right.
They called the county, what are we gonna do? And we have to tell them, there's nothing we can do. We can't help you. You go talk to CVS, you go talk to Walmart, go find somebody that's got it.
And they
But
didn't
we
have it
can't,
yet,
we
right?
can't do anything. That was the answer we had to give them for months until Jay
Right.
finally figured out a way to step up.
Right.
So I think the point is that we've got something, it doesn't have to be big, but at least now we've got a central focus that this is where we can send them to our public health clinic, whatever it is. It'll get them started to get them into whatever they need for the next.
Right.
Event.
Well, that's right. Again, and what the key, I think the key that you just said, not just community ask, but your ask as county commissioners, as county leaders, as, you know, Chamber of Commerce, large business, whatever. It's like when they say, what are we gonna do and who can we go to? You know, short of hitting Jay up as your only full-time employee that had anything remotely to do with that, and then asking Dr. Blocker to leave clinic and come to the commissioners meeting. Right? I mean, there were a few times where I was in and out of there, and I mean, I literally had patients sitting in the chairs, and I was doing what I could, but you know, I'm not a county employee, right? You know, the city hired me for a while in the midst of it, but we didn't have a nurse educator or a public health person, like I said, clinic or not.
We still don't.
Correct. So you know, I think there's some value in at least considering having some high value asset to at least as a starting point. So when it comes to activating this stuff, hey, if we have an existing clinic we need to close down for a week or two or even a month to do the next round of COVID immunizations, then everybody understands that. If you don't have a clinic at all, you don't have a function at all, then again, it's like, well, talk to your doctor or talk to CVS or Walmart and Walgreens, and that wasn't good enough. At least the perception was that wasn't good enough.
I can
Well,
tell
and I think that that was a supply issue though, I mean,
That's
that's,
part of it.
I don't know as though,
Yeah.
would that have played out hugely differently, or was it just?
It was also testing. It was testing first, and then it was vaccination, right? So first it was like, hey, you have to be COVID tested, or you can't go back to work or school or what, right? And you couldn't get a COVID test. Then we can figure that out, and then it was, now we got a vaccine, how do we get it, right? And that's the natural flow of any of this kind of stuff. But one of the key things was, until we were able to say we have a location and we have someone to take ownership of vaccines when they are available, it didn't matter, because we didn't even have a consideration of vaccine up until we could say, Ricky Reeves and medical director, and this is the location, and we can give so many a day, and we had to guarantee that to the state to even get vaccines. So we were delayed by a month when other folks were already at the table to get those vaccine supplies in. And that's always gonna be the case, quite honestly. If you don't have a starting point, if you don't have someone that owns it, right, that you can say, hey, this is our person, right, and we need to build this and figure it out. We were literally a month in trail, and to most of our community, that wasn't good enough. I don't know about y'all's perspective, but to the community at large, and to Senator Birdwell, who's calling me asking why the heck we didn't have anything, I told him the same thing I told you guys. Well, Senator, we'd love to do it. I don't have a place to do it. I don't have a team to do it. I don't have volunteers. I don't even, at that point, we didn't even have a volunteer list, which we have to get out to do it.
two things I want to add to that. One, no doctor in this community wanted to step up and be the doctor to order it. They point blank told us, we're not getting involved and we're not doing it. So therefore, there was
The
no
hospital
doctor.
wouldn't do it either.
There was no doctor.
Right, that's correct.
They
That
wouldn't.
would do it. So then that became my problem number one. I don't have a medical license to order it.
Right.
She can't give it to me because I don't have a medical license.
And I wasn't the medical director of a clinic for the county to order it either.
Correct, so I couldn't use him because he's just a volunteer. So being able to get my hands on what supplies the state had available was non-existent. So what happened is, I got tired of getting my butt chewed out from all the community of, I can't do anything, to going home feeling like crap, to coming up here and going, I'm gonna do something, and going to Ricky's office and said, I can't take another phone call that says, I can't do anything. Because you didn't hire me not to do anything, you hired me to do something. And so me and Ricky started knocking on doors and getting told no, 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 no. His own medical director stepped up and said, use my license and fill out the paperwork, I'll take the responsibilities on it. And that's how we ended up getting the vaccine, was because she stood up and said, I'll do it. And that's how the vaccine hub came about.
And if I could tell you, the authority for that was because Texas EMS is our provider for medical training for all of our volunteer fire departments and everybody around the community. And so we were able to use that link, that connection, to say they represent Hood County in this instance, and that was what we used as the source, right? So it was it was the virtual piece that we have EMS scattered around the county that are volunteers, and we use that license to get credit for Hood County.
The second thing I want to touch on is you talked about you can go get it anywhere. Not everybody feels like they can go get it anywhere, and not everybody can go get it anywhere. We have people who are not insured, that are worse than indigent, and they look at it as, I can't go there. We vaccinated more people in the hub because they felt comfortable to come there and get it, because they knew there was no attachment, they didn't have to have insurance. And so you're touching that part of the population that kind of gets left out because they don't feel like they fit in that box or this box.
Well, they didn't have to fill out a form that says I'm poor, basically.
Correct.
Well,
It wasn't an embarrassment to them to go and get this vaccine.
Right.
There was no
Well,
criteria.
And I may not be saying it right, so.
No, but you're right, that's all part of it. Part of it, when we look at what are the needs in our community, as I was saying earlier, when we did when I say we did the assessment that was done in 2018, published in 2019, that was a collaborative effort between a lot of our volunteer organizations around the community, and nonprofit organizations, was they talked about access to healthcare, they talked about being able to get to and from healthcare and work, things like that. So part of that was, yes, you could get an immunization in Tarrant County, but they had a hard enough time getting from the edge of Hood County to here, much less going to another county for it. So when you look at that larger, you know, what is our responsibility, what's our burden, what do we owe our neighbor, what do we owe our residents of Hood County? That's kind of one of the reasons why they encourage some type of health infrastructure, even if it's not a full health department, because again, you got a starting place for those functions. And that goes back to what you were saying before about the indigent clinic. There's a certain amount that there's already kind of the expectation there, but that was apparently outside of the scope of the indigent clinic, or else why weren't we using those resources for immunizations for the county? I don't know what to tell you. I got nothing to do with that, because again, that's a separate, that is a function.
I just didn't know
Yeah.
how blurry the line between those two functions could get, or if they're, you know.
They can be consolidated with direction of this body and formalizing those, you know, budget structures and manpower structures and spatial, that is a possibility, yes.
And so that's kind of what I'm starting here, of trying to be able to do the educational piece, having that educational piece that anybody in the community that needs that type of help can go get, because we're providing it. And oh, by the way, because you know, I know she talked about doing a lot of the epidemiology stuff. I kind of consider that another step. Let's start here to where, yeah, if we need to give you a vaccine, we can, because you can't go here, you can't go there, or whatever that reason is. We're able to do those functions and assess. And if they have that assessment, and oh, by the way, they need a doctor, but they don't have the insurance, then they get referred to either the indigent clinic or to whoever can
Right.
help them.
Right.
Even through the health screening assessment, if you have that woman come in, she doesn't have insurance and she knows that the health clinic can help her and she's pregnant, but now she's got a resource that can tell her which one of these places that can go, because
Right.
that's what my job would be now. If somebody calls, I'm gonna figure out, is it Ruth's place, you know, I'm gonna have to
Right.
ask Dr. Blocker,
Right.
which way do I need to refer this lady to, because I don't know.
No, you're right, Jay. 85% of the folks who were at the poverty level that were interviewed during that assessment said they didn't even know where to start for any of it. You know, they just felt that they were without a plan for anything health related, immunizations, the stuff for women, infant, you know, COVID, you name it. They didn't even know where to start because they didn't feel like they had any, you know, they didn't belong to any of those systems, and no one had reached out to them or advertised anything outside of Ruth's Place, you know.
And so
Which is a nonprofit in the area, right?
And so reading through all of the documentation that has come attached to this check, and continue to read, is this was the perfect round peg scenario to be able to fit the whole perfectly, as this is an opportunity that we can kind of bridge. It's a little bridge, but it bridges a little gap. And then as we learn and we build it out to what it looks like and what everybody feels comfortable with throughout the next years, then we can make that bridge bigger. And then if we get to that level of kind of what you're trying to tie into of a health department, then we merge it all together, hopefully, to where now we're providing all of it under the umbrella, and then it's one place to go shopping to get it all. And that's way beyond my point of
We didn't
being
even,
employed.
and we didn't even talk about mental health. That's a whole other.
And I don't want to step, yeah, I'm not stepping on Pecan Valley's toes,
That's
this
why I
is
say
strictly
you
all
got-
health.
No, down the road, that maybe you, somewhere you can get those things
Yeah.
coordinated. But you can't do that without at least starting.
I'm just asking to have y'all look at it and take a look and see if there's a good starting point, based on all the knowledge that we're trying to provide, and answer the questions as best we can, as, because I'm like you, we got Ruth's Place, we got indigent care, we got all this, but then when you start reading and looking and assessing, you realize people don't have a place, like you said, that starting point of education to help them know where they need to go.
So you don't know an estimate idea of where to
I
start,
know-
how much dollar wise?
I know what I've set aside to help us start. I mean, I'll be glad to tell you if the judge says he wants me to. But I don't want to get locked into that. Basically, we know what the salaries cost, working on with Dr. Blocker, so I do. But I didn't know if that was the part of the workshop that we wanted
I
to
don't
get
think
into,
we're far
so.
enough down that road yet to
So,
look at everything.
So I'm talking around in a circle, but yes, I have put that together with the help of Doc Blocker, understanding based on what Doc Becky has provided us on what those people cost. And then the only cost we do not have is the building free, or does the building cost? And that's the only cost I do not have We've got built-in supply costs, we've got, the cost of fringe benefits and salaries, but, and a little savings account to make sure that if we do go over, we can still supplement that even 4 to 5 years down the road.
Good. Do you have anything else you'd like to add, Doctor?
Well, I'm not sure in the grant or not, does it allow a mobile unit?
Yes, because I'm making a recommendation down the road for,
You know, as a newly
another
established
top.
unit,
Don't make me hurt.
whatever you wanna call it,
Don't bring them in.
taking that
No, no,
mobile
it's a bunch
unit
of-
out to all of your smaller communities shows them that you're there and that you care and that you, it's kinda like this in the field advertising. The SHS, we don't have that capability, that's why you don't hear about us, cause, you know, but it just,
But
it's
the
one of
response
those
teams,
things.
a lot of the regional response teams like do.
Yeah, but, you know, that mobile clinic, if you're having problems finding an actual building to do the clinical aspect in, that could be an option, through that grant if there's money. I don't know how much you all got, so.
Yeah, I'm not sure what, I would be afraid to know what a mobile clinic would cost.
I think there's different, like, WIC, you might want to check with your local WIC, that's not through DSHS anymore, it's through HHSC. But I've seen many WIC, agencies in the more rural communities have these mobile units, and they do blood draws, and they take all that, so you might be able to get a good estimate from them.
Kinda like the Carter Blood Center. That's a big plus. They take blood.
Just do a mobile and not a building.
Well,
But other
this
than
is,
that, just let me know how we can support you.
I just still going back
Public
to the
health
same
is always-
grant, I go back to the same grant person. If you had some person who was looking for everything, it may be a grant for a mobile unit going out there collecting stuff. I mean,
There's a lot of private foundations that are out there that will fund these types of initiatives. Your United Way, you talk with them, they might be able to fit a special initiative through their campaigns. It just really depends on your community makeup.
I know we've helped the local United Way folks with some of the grants and actually tied them to the other educational organizations, UT Arlington, University of North Texas Health Science System, even Tarleton from the standpoint of the educators and researchers and things like that. Again, even without a health department, we've been able to help tie some things, bring epidemiologists on board to research some specific, grant programs and research programs and things. And so, there's lots of opportunity to continue to build that. We've talked to Judge about the fact that we're building a residency program out at the hospital. And one of the requirements for the residency is for the doctors and folks in training to be involved and learn about community and preventive medicine and public health. And so, again, even with the current status we have without a health department yet, there's a responsibility to do that training. And that's tied to the fact that those health education organizations are funded partially through public health dollars and help with rural medicine, which we are. So, even when it comes to some of the staffing and some of the initiatives and manning for those things, I mean, there's already working pieces in place that we can continue to leverage moving forward. Again, we just have to have some type of health function in order to officially lock that in, those agreements with those educational institutions and things like that. Right now, they can't make an agreement with Dr. Blocker. They could make an agreement with the county, but again, they can't make an agreement with the county health function because it doesn't exist. So.
chicken and the egg.
Somewhat, but the fact, to me, it's a win that we're having this conversation, because if nothing else, you're more aware and informed about what's here now, and all the amazing, look how much we've accomplished without a health department. Now think what we could accomplish if we, hired 2 or 3 people to write some grants and give some immunizations and do it as a county function, and use that as a framework moving forward when we do hit some of those thresholds of 75,000, 100,000. I mean, it's inevitable. We're headed that way. We can either be prepared for it or be surprised by it, you know? I mean, those are our options.
Our funding that we got from the treasury is based on about 73 to 75,000.
Well, all right, well, we've been here an hour and a half. I want to thank everybody. Thank you very much for coming down, Dr. Royer. Thank you, Ms. Cruz. And with that, we'll go ahead and adjourn the workshop.